If you think your IVF doctor should make all the big decisions for you, you're making the first big mistake. Because here's the truth, you should be the CEO of your IVF journey. Let me explain. My role is to guide you with honest, evidence based information. But you bring your own priorities, values, emotional thresholds, and budget to the table. You're the one who has to live with the outcome, so the final decision should be yours. Think of it like this: I'm your advisor, but you're the CEO of your IVF journey. Here's my simple formula: understand the science, your real chances, risks, benefits, and alternatives. What are you emotionally ready for? IVF can be a roller coaster. If something doesn't feel right, trust that instinct. And here's a tip: write things down. The pros, cons, your feelings, your partner's input. It keeps you grounded and helps avoid regret later. Even the best doctors can have biases. Some may overtest, overtreat, or recommend unnecessary add-ons like ERA, PGTA, or immunotherapy. If you're not informed, you're vulnerable. But when you make decisions consciously, you gain peace of mind, knowing you did the best you could with the information you had. No one, not even me, can guarantee a baby. The future is unpredictable. Your goal shouldn't be the perfect decision, but a well-informed one. If you've done your research, asked the right questions, and made choices consciously, you'll be able to sleep peacefully at night, regardless of the outcome. So my advice: become the most informed patient you can. Read reputable sources, ask questions, yes, even the so-called silly ones, use tools like my website and my AI twin, and treat every decision as a shared responsibility. The IVF process will test your patience, resilience, and clarity, but it will also give you skills for life. And if you'd like a second opinion, you can book a video consultation with me at the link below. It could help ensure you're on the right path and save you significant costs in the long run.